There's growing concern tonight that the deadly MERS virus could be spreading in the U.S. after dozens were exposed to the respiratory infection at 2 Florida hospitals. Eyewitness News reporter Susan Hogan joins us now with the latest developments and what local health officials are doing out of precaution.
Well, the Rhode Island Health Department says it's receiving regular updates from the CDC, and they've sent a health advisory to all Rhode Island physicians and emergency departments statewide. 2 Orlando healthcare workers who were exposed to a patient with MERS have tested negative for the virus. The hospital is still waiting for test results for 18 other employees who may have been exposed to the Middle East respiratory syndrome and were sent home as a precaution.
It has a very high mortality rate. About 1/3 of the people who have acquired this infection have died of it.
The virus causes coughing, fever, and sometimes pneumonia, which can be deadly. More than 500 people in the Middle East have been infected this year, the majority of the cases in Saudi Arabia. The infected person came to the U.S. from Saudi Arabia on May 1st. The passenger took 4 flights to London, to Boston, Atlanta, and finally to Orlando. While flying, the traveler developed flu-like symptoms and was admitted into the hospital in Florida a week later. The CDC has started posting these warnings at major airports, explaining the risk to travelers. And the Rhode Island Department of Health says risk to the general public is low. MERS does not spread easily from person to person in public settings. It's spread through close contact. Best protection is to wash your hands frequently. The Health Department is also advising hospitals and healthcare providers here to practice meticulous infection control protocol. Now, last week, a patient in Indiana was hospitalized with MERS but has since been released. Currently, there is no cure or vaccine for the virus. Susan Hogan, Eyewitness News.